Heard about 1,000 things about the new health care law we've been talking about for close to a year, over a year. Probably not this, though. Tucked into it, there's a program that has escaped a lot of people's attention, and William Lajeunesse is joining us now to tell us what we're talking about here. William?
Well, Jane, this is something entirely different and totally under the radar, easily the most underreported provision in the health care bill. You look at your paycheck, you see deductions for federal and state taxes, Social Security. Well, soon you will see another federal deduction for long-term care.
Unfortunately, when we're young and we're working, we never think about getting old.
Dolores Dolgoff still lives in her own home, but knows many others aren't so lucky.
A lot of people give up their homes, their apartments, and move in and pay for a good one, a decent one, $4,000, $5,000, $6,000 a month.
But most can't afford that, and a new health care provision aims to help by automatically deducting from American paychecks money for long-term care unless you opt out.
And this is a really scary proposition where the government passed a huge new entitlement program with gimmicks and tricks, and the American people don't know that they're going to be automatically enrolled in this by their employer if they don't watch out.
The government expects premiums to average $146 a month. On retirement, enrollees could receive $75 a day in benefits.
$75 a day in flexible cash will be enough for most people who need long-term care and who are at home now to stay at home, which is where they want to be.
Supporters say this puts the burden of paying for long-term care where it belongs, on each individual.
We are convinced that a cash benefit is the best way for consumers to get what they want, where they want it, and when they need it.
But opponents say the fine print tells another story. Unless modifications are made, analysts say, the program will add to future federal budget deficits in a large and growing fashion.
In the early years, there'll be money in it, but at the end of the day, there won't be enough money to cover the problem.
Now, this deduction was scheduled to begin next year. It will probably be 2012. Again, Jane, this is voluntary. However, you have to opt out. And finally, the proponents say this is designed to relieve pressure on Medicaid, but I've seen cost estimates from the government as high as $240 a month. Back to you.
Wow, William.